Good morning, I'm Dr. Deuk Majan, CEO and founder of Deuk Spine Institute. It is September 19th, 2024. We are performing cervical spine Deuk laser disc repair. This is an advanced surgical technique with endoscopic laser-assisted surgery to correct a herniated disc in the neck. Our patient has 2 herniated discs. She travels from Arizona to Florida to the Deuk Spine Institute to have her 2 herniated discs fixed with laser. Her symptoms include intermittent neck pain, headache, cervical brachial pain, and cervical radiculopathy. We've just completed her cervical Deuk plasmarizotomy for facet joint pain on both sides at C4-5, C5-C6. Now we're going to fix the herniated disc. She is asleep. She has a tube. She's intubated. She's what we call chemically paralyzed with a muscle relaxer, so there's no twitches. And I'm going to perform the surgery through the front of her neck. Our goal here is to get to these 2 discs, get to the back of them where the herniation and tear is, clean the tear with a laser, get rid of the pieces of herniation that are in the tear and outside the tear, pushing on the nerves. This is a permanent fix for her. We've been performing this surgery for 18.5 years. She has a beautiful neck x-ray right there. You can see it clearly. We'll show you in just a moment. But I have to first, this is the hardest part of the surgery, is to get between the tracheoesophagus and carotid sheath and its contents. Her neck is super long, super long. I was down there at the base by the collarbone, and you can see that we were down low around 7. All right, let me focus for a moment. 2, 3, 4, 5, 6, 7. So I believe we're in front of 5. You agree? 2, 3, 4, 5, right? So we're doing 4, 5, 5, 6. So we're going to do the disc above and below where I am. Everyone agrees? All right, so I need to move down a little bit. Shot. So 2, 3, 4, 5, 6. I went down too far. Let's try again. And the way the surgery is done, this was developed by the South Koreans. Shot. So 2, 3, 4, 5, 6. All right. Shot. That looks good. AP. I'm using the x-ray to navigate the needle to the correct location, which will be the front of the disc. Looks good. Lateral. We want on the AP view to be in the middle of the spine. AP is front back, and on the side view we want to be over the right disc. 2, 3, 4, 5, 6. You agree, Jordan? 5, 6. Shot. What? What's wrong?
Okay. So it took magnifying off.
Well, put the magnifying back. 2, 3, 4, 5, 6. Shot. That's perfect. Shot. All right. AP. Quick. I'm sitting at the front of the disc now. I've gone through the skin. I've displaced the important structures underneath. I'm in the dead midline. That's perfect. Lateral. Now show the audience on that view. Shot. Sorry. Show the audience where the midline is. It's too late now, but that's okay. Shot. Ooh. Dancing around the front. Shot. Shot. I have to move a millimeter. Shot. All right. Let's make sure we're still in the middle on the AP view. 2, 3, 4, 5, 6. You agree? We're at the bottom of the 5, 6 disc. We're dead center. Show us the center. You can tell the center because of the spinous processes. We're right in the middle. It's perfect. It's exactly where you want to be. Lateral. You can see the staples there where we did the Deuk plasmarizotomy for her facet joints. You can see the trachea and esophagus. Jordan will show you. You've got the endotracheal tube and the esophageal temperature probes, 2 little lines. They're displaced off to her left. Shot. All right. Any questions? Feel free to ask me during the surgery.
No
Sean?
current questions, so we do have a comment coming from Lanu on YouTube
Hi, Lanu.
saying all the videos are very good and easy to understand, even for people who don't have any medical background. Thank you.
Shot? You're welcome. All right. So this is, let's count. 2, 3, 4, 5, 6. Everyone agrees we're doing 5, 6 and the one above, 4, 5. Shot? I'm doing a discogram now. She has a lot of scar tissue in this disc. It's unusual. Shot? Yeah, very unusual. Interesting. I wouldn't have picked up on that on the MRI. Shot? Yeah, there we go. So take a look at that. That's a beautiful picture. Jordan, can you get a zoomed in of that tear in the back of the disc? And I can do a little more injection. Tell me when you're ready. Try to get Henry, can you get that picture there shot?
Yes, sir?
You see the tear in the back of the disc? All right, it's gone now because the dye's gone, but do it again. Shot? And again. All right, perfect, right there. Henry, I want you to capture that for our website to
Copy
show
that.
the annular tear. Show us where the tear starts. Yes, right there. That's the inside of the tear, and where it ends, into the herniation. That's where the herniation came from, folks. That dye is tracking along the tear in the annulus. That's what we're here to fix. And I am the first in the world to do annular tear debridement surgery, the first in the world to publish it back 13 years ago now. Or 11 years ago, sorry. Okay, if you have questions, feel free to type them up and ask. But this is the front of her neck. We're on the right side of the front, just off midline. And I'm going between the vital structures, trachea, esophagus. The alternative for her would be an ACDF surgery, anterior cervical discectomy and fusion. She didn't want fusion, neither should you. Everyone should avoid it at all costs if it's possible. Sometimes it's not. But out of 100 fusions being done today, every 100, 97 of them could be avoided and this surgery could be done instead. I'm making a 4mm incision. The entire surgery will be done through this 4mm incision. You guys see that? Right there?
Yes, we do.
We're going to do the whole surgery through that. And that's why our patients don't have trauma to their soft tissues. We're not cutting or destroying anything. ACDF, anterior cervical discectomy fusion, you're slicing through the skin, the soft tissues, the muscles, the fascia. You're pulling the esophagus and trachea apart, the carotid artery, carotid sheath, the jugular vein, all at risk. Retropharyngeal tissues are cut. It's a tremendous amount of scar tissue, hoarseness, esophageal swallowing problems, perforation, lots of complications. With this surgery, we've never had any of those complications. All right, shot. Perfect. I'm going to take the needle out, leave the guide wire. We use the guide wire to advance the dilator. The dilator does not cut tissue, it separates it. Take a look at this, Henry. You see the tapered tip?
Yes, we do.
So this thing doesn't actually cut anything, it pushes it apart. We call it spreading. And that's the beauty of this surgery is there's no cutting. We're literally spreading the tissues apart and they're going to come back together again when we're done. There will be no cutting, no damage, nothing. That's why there's no bleeding, there's no scar tissue, there's no need for pain pills afterwards. People take a Tylenol, that's it. You know? I think we're good. I've already seen the AP. Let's go ahead and I'm going to advance this. Now, people ask me, Dr. Deuk, are you cutting the front of the disc? Are you putting a hole? No, we're not. We're actually just spreading it. Shot? So in the front of the disc is the annulus fibrosus. What is that? That is a connective tissue membrane, like a ligament, that holds the jelly in the middle of the disc, and it wraps around the disc, so it's in the front and back. And her shot, no, I think we're okay. Thank you. There's a lot of scar tissue here, a lot of inflammation, been going on for years. I can feel it. Normally, if this was normal disc, like in the center, this would advance really easy. Super easy. What's her muscle status? How many twitches? Shot? Yeah, check. Because it feels like she's tight. I bet you she's at a twitch or two. I want to get further back. Shot? Shot? Yeah, it's very scarred in here. I think this is more than skeletal muscle. This is a scarring of the disc issue. Wow. Yeah, she's tight, huh? Yeah. So she needs a little more muscle relaxer. All right, that will help. Because her paraspinous muscles are tightening up and compressing down on my dilator. All right, any questions?
Yes, we have a question coming from JMC on YouTube.
Hello, JMC on YouTube. Shot. Wait, before I take the question, I just want to show you all that are watching. The whole surgery is done through this tube. You guys see that? Now,
Yes, we
you're
do.
asking yourself, how come I've never heard of this surgery? That's because this is a new surgery. It's a state-of-the-art advanced technique. It doesn't use any metal implants. We're not putting any metal plates, cages, screws, nothing. So the companies in the United States and the world that sell metal implants for ACDF, for fusions, for artificial disc, they don't want you seeing this surgery. They don't want surgeons knowing about this surgery. They control the universities. They control the meetings that we go to that teach doctors new devices, new technology. They don't allow this surgery to be seen. They're blocking it, which is why we broadcast it, so people can learn the truth. This is the future of spine surgery you're watching. But doctors won't do it because they're being blocked by the companies that sell these implants and make billions of dollars selling spinal cord stimulators and other implants, okay? So you're not going to hear it from your surgeon. You're not going to hear it from your hospital because they don't know about it, or they don't know how to do it, of course. They don't have the instruments. So why am I showing you? Because I used to be one of those fusion surgeons. Yeah, a little inline. I used to do fusions all the time. I've done 1,000 on the neck, 1,000 ACDF. Shot? It is a little better, yeah. 1,000 ACDFs, okay? And I learned this technique and I said, my God, this is incredible. This is far better for a patient than ACDF. And so I started to do more and more of them. At this point, we've done 2,150 of these surgeries. And the patients love it. It's incredible. It literally fixes all the neck pain from the discs. It fixes the arm symptoms from the disc, headaches from the disc, call those cervicogenic headaches. It literally fixes all of that permanently. There's no need for more surgery. So now, are we reconstructing the disc? Are we putting a cage and making more space? No, we're not. But you don't need that. Nobody does. It's unnecessary. I was taught you needed it, but the truth is you don't. Okay, questions? Look at that. Not a drop of blood, not a single drop of blood. All right? The whole surgery is basically bloodless. It's done with you asleep. It takes an hour to recover, and then you go home. And there's no metal. There's no trouble swallowing. There's no hoarseness. There's no complications. There's no adjacent segment disease, no implant failure, no hardware failure, screw back out, screw loosening, plate loosening, no unsightly incision. The recovery, you can go back to work tomorrow, literally tomorrow. All right? You can't lift heavy things, but you can go back to work the next day. Questions?
Question coming from JMC on YouTube asking, aren't you doing a large neck fusion this week?
Yes, we were, but it canceled. We could not intubate the patient. So we had to cancel the surgery. We could not get the tube down. Her tongue was really, unfortunately, really stiff and would not let us get the tube down. So without, I need the laser on. Without the tube, is it set at the right settings?
Yes, sir.
Without being able to put a tube down for general anesthesia, you can't do a large fusion. So we had to cancel the surgery. Good question. Fair question. That will not be happening. Not this week.
We have a question coming from Rita on YouTube
Hi, Rita.
saying, "Hi, good to see you again. I haven't been too well, had a couple infections. Can you tell me why I was told if I had a rhizotomy, may last 3 months and new pain would start back up? Back, hip, knees, pain, infusions still."
Not sure I understand the question entirely, but I'll take a stab at it. So, Rita, you're having pain all over, it sounds like. I think you need to be checked out. I would love to be able to examine you. Happy to do it for free. We can do it by Zoom. We do it for anybody that wants to do it. Everyone out there, we offer a free Zoom consultation, and I'd love to see what's going on and make some diagnoses to help you out. All right, if you can get to Florida, come into my office, it's even better. Look at these bone spurs. Massive bone spur right here, massive. But it's not pushing on the nerve, but it's close, and it's blocking my ability to get rid of the disc herniation, so I'm gonna remove it. People wonder, can these lasers remove bone spurs? Well, don't wonder anymore. We can. Any other questions?
At this moment, no current questions. So in the meantime, why don't we show the audience of how it is we call back pain can cause, or neck pain can cause.
How a herniated disc causes neck pain.
Correct. I was trying to word it correctly. I'm sorry.
That's
not
all
Dr.
right.
Deuk.
Thanks, Henry. Yeah, let's do that.
Of
We're going to
course.
show you a video that will explain. These are bone spurs, by the way. The video will explain how do these disc problems cause so much pain in the neck. Look at all the scar tissue here. Look at this thing. It's growing right out from the disc, the back of the disc, right out into the epidural space where the spinal cord and nerves are. And that is from inflammation going on for years. There's a piece of herniation right there. Look at that thing. It just came out. Guys see that?
Yes, we did.
Pretty cool. All right, go ahead.
Copy that.
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
And welcome back. So you can see from our video just how these disc injuries cause so much pain. It's all due to that tear in the back of the disc. And now we have a way to fix those tears with the laser. That's what we're doing right now, cleaning out that tear. It's called a debridement. That's what you're watching. It also removes bone spurs, as you've seen. If you've been watching, we've taken out several big bone spurs. As a matter of fact, I have to be honest, this patient has more bone spur removal than I've done on any patient recently. So if you're I want to see the laser remove bone spurs kind of person, you're watching it right at this moment. These are bone spurs right here. But I need to remove them to get to the herniation. You see that? See how removing the bone spur opens up the back of the disc so I can get rid of that herniation and the scar tissue and inflammation. All right, any other questions?
No current questions, so we do have a comment coming from a patient who says they're coming in next Thursday for a permanent fix. Dr. Deuk,
Yay.
we'll see you soon.
So thank you. I'm so excited for you. I love getting people out of pain. I love it. So since there's no questions, I'll digress until you ask questions.
We just got a question.
Oh,
Just
well,
got
let me digress
Of
first.
course, of course.
All right. So I was going to say that the comment made by the last person about looking forward to coming and getting fixed makes me happy. That's why we're here at Deuk Spine. We're here for one purpose, that's to cure pain. And we can do it. We know we can do it. It just requires making the right diagnosis and doing the right treatment. And I was going to say, you know, Henry, over the years, I get about an email every week now, people wanting to buy Deuk Spine Institute. It's a little warm. And they're always offering to buy Deuk Spine. But guess who wants to buy it? Venture capitalists, private equity firms from Wall Street, and hedge funds. And I don't want to sell my company to those kind of people. I'm going to tell you why. If you sell your medical practice to them, I'll tell you exactly what's going to happen. They want you to make as much money as possible, profit. And that's not what we're about. We've never been about profit. We've always been about providing the best care to our patients. And what they do, unfortunately, is they're going to want me to stop updating my equipment, stop buying the good drugs, the expensive drugs that work. They're going to want us to go cheap on the patient care, okay? And the reason for that, I've seen it over and over again, it happens all the time, not with us, but with other companies. The reason is that they're all about money. And I don't want to turn this company into a company that's all about money. All right, we have been independent and we've been doing what's right for the patients for 20 years. Deuk Spine just celebrated 20-year anniversary in June. And I've been the leader of this company with my wife since the beginning, and we both have the same philosophy. We don't really care about money, we care about fixing people and their lives. That's what we care about. And of course, we need money to do that. We got to have money, because where else are we going to get the money? Unfortunately, God has not, I'm a gardener, but God has not given me a money tree to plant. If I had a money tree, it wouldn't be a problem, right? Right, Henry?
Yes.
That's what my dad used to say when I was a kid, you know, and I wanted something. I'd be like, Dad, can I get this new pair of soccer shoes? We don't have a money tree growing in the back.
Yeah.
You know, and
Totally.
he's right. There is no money tree. So you have to make do with what you got. Fortunately, we've been blessed. We've been tremendously blessed at Deuk Spine to have amazing people working here with me and helping me, and people like Henry and my team here in the operating room. And we've been blessed too to have enough money to cover our overhead. It's been touch and go at times, and sure, would I love to not worry about the company and every month making overhead? Yeah, I would love it. Nothing would make me happier. That's like the thing that keeps me up at night is, are we going to cover our expenses? Our expenses are very high. This is all scar tissue back here. But fortunately, we have been able to. I believe God wants us to be here to help people. And we're answering the call. So I'm just saying, I thought I'd digress for a moment. We're just about done here. I do want to get a little bit more to the left side. That's where her worst symptoms were. You can see there's just a little bit left there in the foramen. I'm going to twist the tube and move a little bit more to the left foramen here. You can see all the bone spurs I've already removed. So anyway, I wanted to share that with you guys, because we're not, if we were all about just making money, then I would do things a lot differently. I would do what other doctors do. I would do spinal cord stimulators all day long and make a ton of profit doing them. I would do a bunch of shots that don't work, because I know that people would come back and get the stimulator later because they would be desperate. But instead, we offer curative treatments. And we're the only ones that regularly offer curative treatments. There's nobody else in the world that does. That's why people travel around the world to come here. This patient from Phoenix, not from around the world, but on the other side of the United States. All right, we're just about done with this C5-6, and then we're going to move up to C4-5, but I'll take some questions.
This next question coming from Lanu, once more on YouTube,
Hi, Lanu.
asking, why does this patient have so many bone spurs?
Yeah, Lanu, great question. The answer, nobody knows why some people have more bone spurs than others. I don't know, and this is my business, this is my life. I don't know why, but they do. It's definitely part of the arthritis process, for sure. See that guy right there? He's a little too dense to come out. We're done here. All right, we're done with one. We're going to move on to the next. I don't know why some people have a lot more bone spurs than others. Now look here. You guys see there's a drop of blood forming in the tube. Guess what that's coming from? If you're a regular watcher, you'll know. Let's see if anybody can get the answer. Why is there some blood at the back here, at the tip of the tube? What's causing that? If you watch my surgeries and you listen carefully, you'll know.
As we are waiting an answer for this, we do have I believe this is a question and or seeking advice from Rita once more on YouTube, saying that I told my doctor I want to find a way to get to you. They said they do rhizotomies here. I said you don't do laser, but I can't heal a crack on butt skin, so they are saying I might not heal from the tiny cut either. I'm not allowed to stop my high-dose aspirin. It's my blood thinner. Not even for colonoscopy. Said cloud stroke again, so no need for blood thinner.
Well, Rita, I strongly recommend, if we haven't done an MRI review, do the MRI review. Let's see what's wrong and what we can fix. Okay, we are finished with number 5-6 disc repair. We're going to move up to the number 4-5. Let's move the fluoro north a smidgen, and we'll keep taking your questions, folks. What a beautiful spine. Look at that curvature. Show us the curve. That is a normal curve of a normal spine. It's called lordosis. It's curved backwards like a harp or a bow. Okay, we're going to move up to the next disc. To do that, I've placed the dilator back in. I'm going to take the tube out just momentarily, but I'm going to leave the tip of the dilator at the back of the disc. I'm going to take this tube out, and then we're going to replace the tube once we get into the next disc. All right, we've only lost a couple of drops of blood. Now, I'm going to move up. You see where the bone spurs were? They're gone for the most part. Probably 70% of them are gone. And now we're going to move up. So let's do that. Hold on. Let me just focus for a moment, folks, and I'll get back to you. Type your questions. Happy to answer them. In the meantime, why don't you show the audience about facet joint and the Deuk plasma rhizotomy, because we do it differently.
Of course.
Shot?
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
You've seen our video on how we fix facet joint pain differently than everyone else. Now, let's take a look at this x-ray. We're up here at C4-5. Show us, Jordan, number 2, 3, 4, 5. And look at the size of that tear. Much different than the last one. This is a fresher, newer tear. Look at the herniation, how big it is. She was having intermittent symptoms. She was starting to do better. And she said, do I really need the surgery? I said, absolutely. Shot. Because what's going to happen is the symptoms are going to come back. People with symptoms from these disc injuries, unfortunately, they hope that it goes away, but it goes away temporarily in the beginning, and then eventually you just have pain all the time. Shot? All right, so I'm just being extremely gentle with my tapping. We are in the tear. Show them the tear. It's literally right in front of the dilator. You can see it. Yeah, right there. So we're inside the annular tear. Shot. And we're going right to the back of the tear where the herniation sticks out and hits the spinal cord. And now we're going to, for those of you that missed it, the whole surgery is done through this tube. And the reason why you've never seen this or heard of this before is that we're the only company in the United States and probably the world that does endoscopic Deuk laser disc repair. The Koreans were the first to do the endoscopic. There are other countries that do endoscopic, but the annular debridement is new, and it involves removing not just the herniation, but also cleaning the tear. Shot? I've got to be very careful here not to advance the dilator. I want the dilator to stay where it is. It's actually coming back a smidge. Shot? Yeah, you can give me some inline. Dr. Berndes is giving me some inline traction. But look at the tear there. Show us the tear again, right at the tip of the dilator. You can see it. Yeah, so my goal is to get in there. Shot? And get back to that tear, remove the herniation, as well as clean the tear. Now that wasn't taught to me in my training, and I went to the top neurosurgery training program in the world at the time, University of Florida in Gainesville. It's no longer the top program. That was back in the 80s and 90s, but especially the 90s. But we were never taught endoscopic spine surgery, not like this. We were taught endoscopic brain surgery is becoming more popular, but not endoscopic spine. And this is something I had to go overseas and learn from the South Korean. Dr. Sang-Ho Lee and Dr. Gun Choi, two neurosurgeons in South Korea at Woodidal Hospital. They have about 7 hospitals all over Korea and even at the airport. And so I had to learn from them how to do this part where you put the tube in. But then the laser part, that's something that I pioneered myself because I found the laser to be more precise than any other instrument in the world. Surgeons that are doing spine surgery are using basically barbaric clubs to fix your spine, and they're not even doing a good job of it. But with the laser, it's far more precise than any other surgical instrument out there. And what I mean by that is, this is all inflammatory tissue, by the way, and scar tissue from the herniation. That's a piece of herniation down there. What I mean by that is that this laser will remove tissue, okay, at 0.05 millimeter. That's, take a millimeter and cut it into 20 pieces lengthwise, and you're going to have a 1/20th of a millimeter, which is almost, you can't see it with your eye. I would not be able to see it with my naked eye, but I'm not using my naked eye, am I? I'm using the endoscope. And this is a very special endoscopic system. And this system allows me to see down to a level of a 1/20th of a millimeter. Okay? There's all pieces of herniation coming out. You guys saw that white thing? Looks like cottage cheese. That's
Yes, we did.
actually herniation. This is all herniation. And I'm lasering it right off the annulus because that's where it's stuck down. It will not come out on its own. You have to literally blast it with a laser to get it out. Sometimes we even have to put a grabber in there and grab a chunk out. There's another piece of herniation right there. See that? Now that guy's coming out because I freed him up. Questions?
Questions. We got a few.
10 minutes, Dr. B, 10 minutes.
Next one coming from
Do you
Robert.
hear me? Hi, Robert. From
On
YouTube or
YouTube.
Facebook?
YouTube.
We don't get many questions from Facebook or LinkedIn or X.
We got a few from X last week and also with LinkedIn,
right.
but yeah, just today for not as much as
Get
as
a
we
lot
like
of
to with
YouTube,
Facebook.
which is we're not complaining about.
No.
We're nice to get some engagement from other platforms.
Of course, of course. All other platforms are welcome. Next one, question from Robert asking, how do you displace the trachea?
My fingers. My fingers displace the trachea. Isn't that cool? All right, guys, you're about to see a herniation come out of the foramen. This is the neuroforamen down here. Look at that herniation. Boom. One of them, there's more. This is the side that was bothering her the most. It's the left side, her left arm. Okay, there's another piece right there. Look at this thing. It's a beast. Oh, here it is. Oh my God, I love this surgery. How awesome is this surgery? Removing all the herniations without opening the patient up. Almost no blood loss, no recovery, 1 hour, and the patients go home. This is the best. Take it from a surgeon who's done 1,000 ACDFs and 500 PCDFs, posterior cervical. There's another herniation. So this disc is clearly fresher herniations than the last one. Like I told you guys, remember when we did the discogram a few minutes ago? The tear did not look the same. It wasn't like tight, collapsed. It was big and diffuse. That means the tear is huge, and this is a huge tear. So this is a fresher, newer, huge tear. We're going to clean it up, and she's going to do fantastic. She's going to be very happy she got this done. It's important that if you have this surgery with us, you don't do too much the first year. Oh, look at the herniation coming. Oh, that was sitting on the C5 nerve root. Literally pushing on the front of the nerve root in the foramen. That was incredible. I want you to put this, oh yeah, another one. Hey Henry, put this surgery, I don't know how we can put on the website, under cervical Deuk laser disc repair page. But this is a great one for people to see.
I could definitely...
I mean, it's so perfect.
I'll get
You're
more.
getting all these herniations coming out. It highlights the fact that a herniation is not one piece, it's many pieces. And it happens over time. I want you to give this to Sanjay.
Yeah.
I want it on the cervical Deuk laser disc repair page. Somehow, you know...
Yeah, I'll talk with him. That's not a problem. I'll see what we can
it doesn't have to be front and center, but I think this is a good one for people to watch.
Yeah, no, 100%.
Yeah, maybe we have our best videos page.
I was gonna say that
Something like
we can.
that.
I can like highlight
videos.
Exactly.
Yeah, but make sure you put in the highlight cervical DLDR video. Here's some more bone spur. Yeah, we'll take questions. Sorry, folks, I'm just getting a little excited.
This next question, it's all good. Next question coming from Bell on
5 minutes.
YouTube, asking if I have severe cervical kyphosis along with degeneration and myelomalacia, excuse me, at C5-C6, is the DLDR feasible or even dangerous? Wouldn't a corpectomy or ACDF be better for herniations from C3 to C6?
Yeah, Bill, so the answer is the Deuk laser disc repair is far safer than a corpectomy or a discectomy or any other surgery. Far safer. Why? Because look, we can see everything. You can't see these things when you do a corpectomy. Your visibility is far reduced with a corpectomy. You don't get to see any of this stuff. The endoscope is what allows us to see down to, look at that. I mean, that's in the foramen. You'd never see the foramen when you're doing open neck surgery. Never. I've done 1,000 corpectomies and discectomies and artificial discs in the neck alone. Another 1,000 fusions in the back. And this view you're seeing is the best. This is not even close when you have open surgery. This is the best view there is. And my gosh, yes, we can fix, we've had plenty of patients with large disc herniations and myelopathy in the cervical spine, thoracic spine, and we fix them with the laser. It's far better. You don't want a corpectomy. Let me do your MRI review and I'll tell you if the laser will work for you, if you're a candidate. Okay, that's the best thing to do. Don't guess. You ask your spine surgeon, they'll tell you the laser won't work. That's because they don't know anything about laser. They've never done one. They have even no idea that what it does. That they're going to try to sell you on more invasive surgery like corpectomy. That's where the big money is. They make a lot of money doing it. The companies that sell the metal implants make a lot of money doing those types of surgeries. So they want you buying that surgery, basically. Your insurance and you buying it. They'll make $80,000, $100,000. It's an expensive surgery. The implants on that type of surgery will be $15,000, $20,000. Multiply that times 1 million surgeries a year. You can see it's a billions of dollars industry. All right, that's the posterior ligament. It looks good. I don't think there's any more herniation. I am going to take a peek. Okay. You, as an open spine surgeon doing ACDF, PCDF, whatever, you never see this detail. Not even with the best microscope. And we have the best microscope right here. We use them for our corpectomies if we do them. We haven't done them in years. We're just about done. 1 minute. You just want to check over here real quick. Make sure I'm not leaving anything behind. What other questions can I answer? Why don't you type up the questions? I'll come and answer them for you guys, face to face. Haven't done that in a while, have I, Henry?
No, it's been a while, yeah.
Oh, there's one more right there. Not a big one, but yeah, type up your questions. I'll come and answer them because we're done. All right. I want to show you guys the small incision we did. 2 discs were fixed. A lot of spine surgeons will only fix 1 disc at a time. That way they can milk you for 2 or 3 surgeries, make some extra money, maximize the profit. But here at Deuk Spine, we'll do it all in 1 surgery. So why? Because it's safer for the patient. That's why. You don't want to have 3 surgeries. You want 1 surgery. 1 surgery is better than 3. That's one of the advantages of coming here, is that we get it all done in 1 shot. All right. We don't drag it out so we can get more money like other people do. Now, I'm holding pressure, right? So there's a little bit of bone bleeding from removing the bone spurs. Do we ever get an answer on that? Nope. The reason why there's a little blood coming up is we were zapping away bone spurs. Well, guess what? Bone spurs are connected to the bone marrow. And the bone marrow is where you make blood, right? Red blood cells, white blood cells are all made in bone marrow. So if you go back and rewind and watch me laser the bone spurs down, you'll see underneath the bone spur was this, like these holes in the bone. That's bone marrow. That's normal bone marrow. And bone spurs have bone marrow in them. So basically the bone spurs were bleeding after I removed them. The bone marrow was bleeding. Okay? Bone spurs are cortical bone primarily, but also some diploic bone inside. All right, type your questions. I'm going to come answer them, but I'm going to show you. Here's a tape measure. Can you see this, Henry?
Yes, we can.
And we've got a 4mm incision. Let's see if she's ready. Right there, you guys see that?
Yes, we can.
It's about 5mm. I was a little heavy-handed today. Okay, I'm coming to answer your questions. Type them up. In the meantime, Henry, let's show them one more time how the Deuk laser disc repair works.
Copy that.
Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4mm skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debrides the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
I'm here with my patient who traveled from California, Northern California. He had a herniated disc at C5-C6. It was a small disc bulge. He was told by the doctors in California that he should just live with the pain, give it time, and eventually he'll need a fusion. Is that right?
That is correct. I was told that within 5 years I would be needing surgery. So basically what they were saying, live with pain for 5 more years and then we'll do something about it. One of the things that I've seen a lot of the videos is testimonials, and I will always say, this doctor sounds too good to be true. And actually it is true. I appreciate you, doctor. I really think that is really nice procedure, and the staff here is really nice. They're always very friendly and kind to get you through the process, because when you get told so many times that that's your new life, it's kind of, you're always thinking, is really the way I want to live? If I'm going to live a lot of years, why wait with pain? You know, you need to do something different. And always, whenever you see videos, you're always a little sketchy and saying, maybe it's not true. Maybe this is not what it is really saying. But today, when I felt with no numbness and no pain on the neck and just going through the process, I really been blessed. I'll be flying to California today. I honestly can't say much. You know, it's a miracle. Whenever I heard the testimonials, they say you're a tool for God. It actually seems like that's the way it is. It's a miracle through you. God works through you, and it's awesome to feel better, you know?
I'm so happy for you and your lovely wife who's here with you. You can see you had a tiny little incision. You had the Deuk laser disc repair for your herniated disc. You can see we were in there with the laser, cleaning out that foramen on the right side where the nerve was being pinched. There were a lot of pieces of herniation in there. And the laser cleaned them all out, and your surgery went perfect, and here you are less than 24 hours later. Feeling good, huh?
Well,
With
yeah.
a smile on your face. That's what I like to see.
You know, it's a smile of happiness. It's a smile of joy, you know, that it is doable. And I think no one should be able to be living with pain. I was so happy to see testimonials when they used to say, well, the one regret I have is not going in earlier and living 18, 20 years with pain. For me, it's been 3 years since July of 2020. It's been miserable because I've been with pain. And I've been told by doctors, let's just take time. I did all kinds of physical therapy, acupuncture, you name it, everything that's out there, and nothing seemed to help. And today, with 1 day of getting something really that's gonna be for life, it's amazing. It's a smile of joy, you know? If you are going through this trouble, don't hesitate on sending your MRI. When I did it, I sent my MRI for free review, and my answer was, yes, you are a candidate. Here I am today, flying back with literally no pain on my neck and no numbness on my hand, which I miss that. It's awesome.
It's wonderful. Now, what is your native tongue? What is your native language?
It's Spanish.
Are you from Mexico originally?
Guadalajara, Jalisco, Mexico.
Guadalajara.
Yes.
One of my favorite songs. Can you tell them in your native tongue how you feel?
Yeah. Quisiera decirles que si están teniendo problemas con una hernia en su cuerpo, manden su MRI, es gratis y les van a dar un resultado, una verificación si ustedes son candidatos. No vivan con dolor, porque el dolor les va a causar toda la vida, y los doctores allá afuera les dicen que no hay solución, pero las soluciones existen, simplemente las tienes que buscar y creer, tener fe que tú vas a estar mejor. Si Dios te mandó a este mundo es para que vivas bien, no para que vivas con dolor. Así que te recomiendo que por favor tomes esto en serio, hagas ese paso de mandar tu MRI gratis y habla ya sea con quien tengas que hablar para que ellos te empiecen a guiar y te digan qué es el siguiente paso que tienes que tomar. Así que una recomendación con Dr. Deuk. Muchas gracias.
Muchas gracias, amigo. And Feliz Navidad.
Feliz Navidad. Gracias.
Safe travels, my friend. Thank you so much for sharing. And good morning. I'm Dr. R. Deuk, CEO and founder of the Deuk Spine Institute. I'm here with one of my patients who's traveled far to come to Deuk Spine Institute, all the way from Michigan. What brought you from Michigan to Florida?
I was scheduled for fusion to have just my one disc, C5-C6 fused. I'd had disc herniation before in my lower back, had it done. I didn't want to have to go through that again. So I did some research, found you had a good record. Your history is impeccable, so I decided to come down here and have it done.
Well, you didn't have a fusion, though. You had something else done.
Yeah, I'm sorry. So instead of fusion, instead of going through and the complications and risk of fusion, lack of mobility, I wanted to have laser. I talked to somebody in Mexico that had laser surgery, and she said it worked great. So I thought I'd pursue that avenue, and that's when I kept Googling and searching and trying to find the right place. Some places had bad references. You had impeccable record, so this is why I came here, and I'm glad I did.
Yeah, so you were recommended for fusion by another doctor, and let's talk about that for a moment. They were going to fuse one disc, right? Number 5-6?
Correct.
Now, if you go to your surgery video here, you could see that we made a tiny 1/4 inch, 4 mm incision, and we fixed 2 discs, not 1, but 2. And it turned out that the disc that you were not going to have fused was actually the worst one. It was the one that was causing the vast majority of your symptoms. And the reason I'm talking about this is it's a common problem. It comes down to being misdiagnosed. And misdiagnosis happens all the time, all over the world with spine problems. And that's what we're trying to fix, is not having patients get the wrong diagnosis, because the wrong diagnosis will lead to the wrong treatment. Because treatments are always based on diagnosis. So if your diagnosis is C5-6 disc, the treatment will be fusion of the C5-6, but that's wrong because you had 2 discs that were problematic. We fixed both. You could see in that video, we were taking out lots of little chunks of herniation out of your C6-7 disc. Definitely needed to be done. How do you feel today?
I feel great.
Yeah, do you still have the same neck pain you had when you came here?
No, my wife can already tell that my shoulders are relaxed. My neck, I feel great, so very comfortable.
And you had your surgery just 24 hours ago.
Yesterday morning.
Yep, and you can see you have a tiny 4 mm incision with a Band-Aid. No metal, no fusion, no narcotic painkillers after surgery. We didn't give you opioids, so that's another plus to the Deuk laser disc repair.
I agree.
Yeah, you don't need to be on powerful painkillers. You're back on your feet already, walking around, not in the hospital.
Yep, great. I'm glad I had a guardian angel looking after me.
You did have a guardian angel, and you're welcome. We enjoy helping people like you have successful spine surgeries. Is there anything else you want to tell your fans out there?
Basically, if you need this surgery, if you're having complications, neck, back, definitely come here. I don't care what it costs you for travel or whatever. You can't, it's worth, priceless.
I agree with you. It is priceless to get out of pain and have no complications from your surgery, and nothing bad that hurts you or harms you or changes your life in a negative way. So congratulations. And when do you guys head back to Michigan?
Saturday.
Saturday. So you're going to spend a few more days here?
Yes, sir.
What are you going to do for the next couple of days?
Well, we plan on hanging out in the sun, but
yeah,
it's not the case right now.
I think, yeah, well, you could do. Oh, yeah,
know,
it's a little overcast right now.
Yeah.
But this would be a good day for you to go check out the Kennedy Space Center. It's about 10 minutes away. They have all the displays and history of NASA, and it's really worth visiting.
I'll do that.
Save the beach for tomorrow.
There you go.
Sunny day.
All right.
All right,
Thank you very much.
congratulations. You're
Thanks,
welcome.
Thanks again.
Hello everyone, Dr. Deuk Majin here. It's been a while since I've talked to you face to face, but we've just wrapped up our patient who had cervical spine, neck, 2 discs that were herniated with really old injuries, annular tear, herniation. What does all that mean? Well, let's talk about it. Just a little anatomy lesson. So this is the front of the spine. This is the back of the spine with these bones. And the herniations are typically either left or right. Some of them are center. Most of them are actually both sides, but they typically affect one side worse. You can see the herniation here. Can you see that?
Yep.
And it's pinching or irritating the nerve root that goes down the arm. They cut the nerve root on this model, but it goes all the way down to your fingers. So when you irritate the nerve root, people can get symptoms in their arm like numbness, tingling, weakness in their hand, or pain down the arm. And the Koreans were the first to figure out you could go arthroscopically through the disc because it's soft, get to the back and use a little tube to see the herniation and then grab it and pull it out with pieces. Doesn't work well. It doesn't work well at all. Results are not great. They're probably 60-70% success. So I decided, well, what else could I use? What else is available? There's a laser. Well, let's try that. And I started using the laser to clean up the herniation and also the tear. And lo and behold, the neck pain went away, the arm pain went away, the weakness, numbness all went away, and the headaches went away. And we published those results many years ago, 11 years ago now. It's in PubMed, and this surgery, we've been doing it for 18 and a half years, almost 19 years. So that's what we do. We just go with a tiny tube through the disc to the back and zap away the herniation. And then you keep your normal disc, your natural disc. Doesn't matter that it's degenerated, that doesn't cause symptoms. You can have a normal life. You don't want metal put in your neck. This is not natural. And this is what's being pushed and promoted by all the spine surgeons out there. They all want to do a fusion. They want to put the cages in instead of your natural disc. That's going to stiffen your spine. You won't be able to move. And it's going to cause other areas to wear down. The other option is an artificial disc. And basically take out the whole disc. You put this piece of metal. Again, why do you want a piece of metal in your neck? There's complications, lots of complications. Turns out fusion of your neck causes a 50% chance of complication. Artificial disc, 26% chance of complication. All right, why have either? You don't need complications. We've had 0 complications with Deuk laser disc repair. We've done 1,000 cervical patient surgeries in the last 18 and a half years, 1,000 with 0 complications. I mean, can you beat that? Why would you want metal in your neck if you don't need it? 97% of patients having cervical fusions or artificial disc could avoid it and have the Deuk laser disc repair, the procedure you just watched. That's what I would recommend. You saw our animations on how we do the surgery, why it's done that way, and we have a bunch of questions, so let's get to the questions.
First question coming from Bell, once more on YouTube, asking, can you do the cervical DLDR posteriorly rather than anteriorly, such as an endoscopic posterior biportal foraminotomy?
Great question, Bella. The answer is no. You cannot do the cervical Deuk laser disc repair posteriorly. If you come posteriorly, you're going to hit the bones of the spine. And the only way to get past them is to drill a hole in your bones. Then, in front of the bones, you have the spinal cord. And you're going to have to go through the spinal cord. No problem, right? Yes, you'd be paralyzed if you go through the spinal cord. So you do not want to go from the back. Going through the back is a very, very bad idea. It would be like, I have a rattlesnake on the floor in my house. Let me go grab it with my hands. Very bad idea, very bad. You're going to get hurt. On the other hand, you could get a professional service to come get it and remove it with 0 chance of harm to you while you go have a Starbucks. All right? That's the right way to do it. We are doing it the right way. We've thought about every other way. I don't do it this way because it's what I was taught to do. I do it this way because it's the best way to do it. I could do any surgery on the spine there is. I'm trained, I'm perfectly capable of doing anything. But I choose to do it this way because this is the best way to do it for the patient. It's the fastest recovery, most successful surgery, least risk of complications, and the most durable, lasting. It's permanent. Next question.
Next question. These next two coming from Jody, once more on YouTube. First question saying, hi, watching from Australia.
Hi, Jody.
I have C5-C6 disc degeneration. The pains are getting worse, arms and thumbs. I also have it L4, L5. Could this surgery be done at 4 levels at one time?
Yeah, so we can do all your neck and your back levels, no problem. We would do one of them, like your neck, we would do on Thursday, we would do your back on Tuesday. So you need to be here for 1 week, or 5 days really. And then you could fly home Friday afternoon. So be here Monday morning, fly back to Australia Friday afternoon. And yes, we can do it all. Just use our link for a free MRI review, mri.deukspine.com, and you get my face-to-face meeting for 10 minutes where I figure out what's wrong and talk to you about the best treatment for it.
Jody, second question. If the disc does not get replaced, will the pain come back again after the surgery?
If the disc does not get replaced, will the pain come back? No. If you get the disc replaced, the pain will come back. If you get the disc repaired with our procedure, the pain doesn't come back. So disc replacement equals problems down the road for you and more surgery, more shots, more pills, more therapy, more treatment that doesn't work, and more surgery. Disc replacement, bad, B-A-D, bad. Laser surgery, the best. That's why we do it.
Next question coming from Jason on YouTube asking, I'm coming to Duke's spine. Does Kim need me to send anything else?
I'll find out, Jason. I appreciate you asking. I don't know. If Kim needs anything else, she'll tell you, but hopefully you have her phone number and her email. Best thing to do is to ask her. I don't want to know your last name because of privacy, so don't tell us. But I will talk to Kim as soon as we're done here and tell her to reach out to any Jasons she knows.
And then lastly from Rita on YouTube asking a few questions. First being, can you do back, hip, and knees while on high dose aspirin? I had a reaction from regular blood thinners, and that's why I'm on high dose aspirin instead.
Yes.
I'm asking for an updated MRI chart on.
Yes, Rita, we can fix you even on high dose aspirin. There is a slightly increased risk of bleeding during surgery, but aside from that, because the incision is so small, we're not really tearing any big veins or destroying any big veins. We can do it all in one day if you want. I prefer to break it up and do the hip. Probably do the hip and the knee on one day and the back on another, say Tuesday, Wednesday, or Wednesday, Thursday. But yes, we can do it all, even with you on aspirin, but you're at a higher risk of having a bleeding complication. I would put your risk probably somewhere around 10%. Normally it's 0, but 10%. That's pretty low. So we would just have to bandage you up with an ACE bandage and some Curlex, and use a compression bandage to put pressure on the incision. Remember, we're not cutting you open, we're just going straight down and moving around a little bit, and so that's why it's safe to do even on aspirin.
And then kind of answered one of her questions is, can you do knee, back, and hip at once? And then a comment saying, I'm the Takayasu girl with the car accident injuries. They said new veins would grow after and pain would come back. Won't allow surgery. So just a lot of meds.
New veins would grow and pain would come back. I'm not sure what you're referring to, but the pain would not come back with our surgery. And yes, we can do all of them if you're motivated and you want to do it all in the same day, no problem.
And that is it for questions.
All right, thanks for joining us. I'm Dr. Deuk Majan. I'm here with Henry.
Hi.
And we enjoyed your company and your questions. You made it very interesting for us today. Our next case is a patient who's traveling from, I can't remember. We'll figure it out. But he's some other state.
No, this one's from Florida.
Oh, this one is from, I apologize.
Yeah.
The next, I'm thinking of another patient.
Next one's from Jersey.
The next one is Jersey?
Yeah.
So we have another one from Jersey. So the next patient though is actually 4 hours away, Naples, Florida. He's here for a herniation at L5-S1 with laser, and then he's also got a right piriformis syndrome. We're going to do both surgeries. We're going to start with the laser at the L5-S1 on the right side for the herniated disc, the back pain and leg symptoms. He's got numbness, and then we're going to do his piriformis release, which I think is contributing. So he had surgery done at the BioSpine, and he has an interesting story. He told me he went to BioSpine, they did his surgery, laminectomy, didn't help at all. They got a new MRI, it showed a herniation was still there, and then the surgeon told him, I forgot to take the herniation out. And they offered him a refund of 50% of his money. I mean, I'm laughing. I'm not laughing at the patient. Horrible situation. I feel horrible for him. I'm laughing at the absurdity of the situation that this kind of stuff happens today. That's how bad some of these surgeons are, folks. That's why we recommend you choose a quality location. Quality location to get your back or neck fixed. Don't just go to some place because they can mess you up. All right, we'll see you back in about 30 minutes.